Hello, everyone. Sorry for the little delay. We had some technical difficulties, but we're here now. Good afternoon and welcome to Food as Medicine with Dr. Michelle Pearlman. Please note that the webinar is being recorded and you will receive a link to the recording following the webinar. If you have any questions during the presentation, please use the Q&A button at the bottom of the screen. Now, here's a quick introduction of today's speaker. Dr. Michelle Pearlman is an assistant professor in the Division of Digestive and Liver Diseases at the University of Miami Miller School of Medicine. She is also a physician nutrition specialist and board certified in internal medicine, gastroenterology, and obesity medicine. Dr. Pearlman is on a mission to educate the community on the fundamentals of wellness and nutrition and works closely with numerous subspecialties, including bariatrics, hepatology, endocrinology, sleep medicine, sports medicine, oncology, and dietetics to provide comprehensive care to patients with nutritional issues, whether it be malnutrition or obesity. And with that, I'm going to turn it over to Dr. Pearlman. Hi, we can't hear you.
Okay, I need to run back and get my computer. Is there?
We can hear you now.
You can hear me?
Yep, perfect.
Okay. Okay, sorry about that. So I'm going to backtrack a little bit here. Okay, so using food as medicine, in my 12 or 16 years worth of training, not many people actually sat me down and said, Michelle, this is how you should eat to be healthy for your body. This is how to reduce a lot of common GI symptoms. And throughout all my years of training, I was really taught, for the most part, how to give people medication to help treat common symptoms. Now I've really dedicated my career towards trying to teach people how can we choose better options as far as what we're eating to reduce those GI symptoms to begin with. And that is really, really possible with food as long as we have a strategy to do so. Okay, so some key points I want to kind of touch upon before we get the ball rolling here with the nuts and bolts is that how you eat is just as important as what you eat. And when we talk about what is healthy food, well, that really varies from person to person. What works for one person may not work for another. And really, just because an item contains nutrients does not mean that it is quote unquote healthy and will make you feel good. So I get a ton of gastro business come, January, February, because everyone is on this New Year's resolution push to try to lose some weight. And so people go on all these trendy diets and they start eating tons of broccoli and cauliflower and they feel awful. And so they end up going to seek their gastroenterologist because they have a lot of bloating or diarrhea. And they say, what's the point of eating healthy if I don't feel well? So again, just because something has nutrients does not mean it's going to work for you and your underlying GI symptoms if you have them. Food allergies and intolerances can develop at any age, and your body changes from day to day. And so a really kind of essential point here is that what you were able to eat when you were 10, 20, 30, 40, and 50 is often not the same types of foods and liquids you'll be able to eat when you're 60, 70, and 80 and still maintain that weight and still feel the same. And so just as our body changes from day to day and everything is a very dynamic process, our nutrition has to be just as dynamic. So we're going to talk about some common GI symptoms today. We're going to talk about belching, bloating, and flatulence, heartburn and dyspepsia, food sensitivities, allergies, and intolerances. Can you all hear me? Okay. See, okay, perfect. Sorry, I'm getting a seminar.
I didn't know you were in here.
Okay, so let's talk about belching, bloating, and flatulence. So having flatus or passing gas from below and burping is actually a normal physiologic process. It is normal to have air inside of our intestine. The body produces gas as a normal physiologic process. When we take in certain foods, the bacteria, our microbiome, break down these foods and produce gas. So that is a normal phenomenon. The problem is that if we swallow a lot of air or if we eat certain foods that produce a lot of gas molecules, some people are just more sensitive to that gaseous distension. So the average person actually farts 10 to 13 episodes per day, and that's actually normal. Now, some may have what we call visceral hypersensitivity, where any excessive air inside of the stomach or the intestine causes people more discomfort. And so one person may be bloated but feel fine. The person right next to them may eat the same thing and have extreme discomfort. Everyone is different. Some gas actually produces certain odors, particularly those that have sulfur molecules. And then swallowing air is mostly nitrogen particles, and that's one of the primary causes of belching or burping. So when we talk about FODMAPs, you probably have heard this term kind of everywhere online and Instagram and in a lot of social media. And if you're just Googling, why am I so bloated? You're going to see this term FODMAPs. FODMAPs stand for fermentable oligosaccharides, disaccharides, and monosaccharides and polyols. So that is a mouthful. What does that mean? That means that these are short chain carbohydrates that are poorly absorbed by the bacteria in our gut. And so when those foods are not kind of broken down, the bacteria in our gut basically ferment them and produce gas molecules. And it can actually pull water into the intestine and cause diarrhea in some people. So these do not necessarily cause harm to the intestine, but if I were to eat a bunch of high FODMAP foods, things like avocado, Brussels sprouts, broccoli, cauliflower, all things that are quote unquote very healthy and high in fiber and nutrient dense, I may have a lot of bloating with that. And that doesn't mean that there's necessarily anything inherently wrong with my gut. It's a normal physiologic process. So being able to kind of figure out, okay, what are my sensitivities when it comes to certain foods? Is it just I'm eating a ton of fiber and a ton of high FODMAP foods? Or is there something else going on that's contributing? So when you're undergoing an evaluation, not all bloating is a disease process, but you definitely want to make sure that we've ruled out triggers and other underlying disorders that require certain treatments. So things that you would want to talk to your provider about would be making sure that you are being screened for celiac disease. Celiac disease is an autoimmune condition to gluten. Gluten is a protein that's in foods that contain wheat, rye, and barley. And this can happen at any age. It's not that you're born with celiac disease, but you can have a genetic predisposition, and then anything, any sort of stress in your life or infection, that can kind of trigger this autoimmune reaction where you now have a problem with gluten ingestion. You want to obviously make sure that you don't have something like ulcerative colitis or Crohn's, that's inflammatory bowel disease. Small intestinal bacterial overgrowth, we have billions of bacteria in our colon, not as much in our small intestine. And for a multitude of reasons, people can get excessive bacteria that reflux from their colon into their small intestine. And that can definitely cause bloating and diarrhea for some people. Other things you'd want to consider is, I'm just a glorified plumber. The GI tract is just one long tube, and it's a plumbing system. And so if things are backed up from below, then you can definitely get issues with excessive gas that just kind of sits in your intestine because you're not emptying properly from below. So treating that constipation aggressively can be very, very helpful when it pertains to people who suffer from gas and bloating. Medication. Medications can be helpful for a number of diseases and symptoms, but they always have side effects. And so also, looking over the side effect profile and discussing the common side effects with your provider can be very helpful. And then we're going to talk more about looking into food intolerances and food allergies. So lifestyle modification and dietary modification is really the gold standard when it comes to management and treatment of any chronic medical condition. When it comes to some of these common GI symptoms, this is where you can really get most of the effects, the positive effects. We don't have great medications to treat gas and bloating. So the two main things you really want to focus on are reducing excessive air swallowing, also known as aerophagia, and reducing gas-forming foods. Those are your high FODMAP foods. So again, when we talk about excessive air in the intestine, these are the two main things we want to focus on. You also want to limit supplements that contain sulfur. So common supplements that people take for joint pain or arthritis, things like chondroitin sulfate or glucosamine sulfate have sulfates in there and can actually cause issues with bloating and excessive air production. Some over-the-counter medication options would be things like simethicone or Gas-X or Beano. Those are kind of digestive aids that help break down some of these carbohydrates. But really, there's not great data to show their effectiveness. Again, your biggest bang for your buck is going to be reducing those food triggers. So choosing low gas forming foods and reducing excessive air swallowing. So some of the lifestyle changes that are really important that we're going to go over here. So things that we think are normal behaviors or that we're taught to do when we're starting from honestly babies would be things like avoiding straws, using narrow-mouthed bottles, cigars, cigarettes, and pipes. All of those actions, you're basically just sucking in the fluid, but along with the fluid, you're sucking in air, and that causes excessive air swallowing. I am very guilty for this. I literally inhale my food, and I think a lot of us are guilty of that because we don't have 30 minutes or an hour to just sit down and relax and chill, put food in our mouth, chew it to where we can no longer feel the food consistency in our mouth, swallow it, enjoy the food. We don't have time for that, or we're doing 5 million things while we're eating. And so that plays a huge role in GI symptoms that, like I mentioned before, it's not just what we eat, but how we eat is equally as important. And digestion starts in your mouth. So if you give yourself 5 minutes to eat something and you're inhaling the food, you're not even chewing it down properly, you're basically having undigested food molecules go into your stomach, then your intestine. And because you haven't broken it down properly, you're not going to absorb it properly. And the bacteria in your gut are going to end up fermenting a lot of those food particles. So really eating slowly, avoiding gulping can be very, very helpful. Also, people tend to obviously socialize around food, and we often talk while we're eating. But again, that really introduces a lot of excessive air swallowing. You want to try to avoid or limit frequent repetitive swallowing. That can be caused by ill-fitting dentures, chewing gum or tobacco, sucking hard candy, or frequently sipping beverages. All of that, again, you are sucking down excessive air. You want to try to remain in an upright position after eating. So, it's a plumbing system, and a lot of this is mechanical. If you eat a large meal and then you lie down, even if you're not sleeping, if you're lying down, whatever you just ate, whatever air you swallowed is kind of going to get trapped in your stomach and your small intestine. So the more upright you can be, if you go for a walk after dinner, that will really help things empty properly. Exercising regularly is very important. That doesn't mean you have to do CrossFit by any means, but just moving your body allows that air to really move more freely. And then stress management. If I could have a prescription pad and give it to all my patients that said, doctor's order, stress be gone, I probably wouldn't have a job. So stress plays a huge role in sending neurotransmitters to our gut that really play a huge role on the movement of air, the acid production. And so stress and anxiety, boredom, fear, you name it, our emotions play a huge role in what we feel in our gut. So in general, when it comes to dietary recommendations, there's really no perfect diet. It depends on what people's food preferences are, what their budget is, what their schedule is like. But in general, these are the recommendations that I give people to reduce the excessive air swallowing and air production. So really avoiding all carbonation. It doesn't have anything necessarily to do with the sugar, whether it's regular soda or diet soda or sparkling water. Anything with bubbles has air in it or CO2. So all you're doing is you're just drinking that air. People will often tell me, but it helps me burp. It helps me get rid of it. And those bubbles that you just swallowed, it's actually, you're trying to burp out all the bubbles that you just swallowed. So in general, I never recommend carbonation. I think it's an old wives' tale where when people are feeling ill, we're given ginger ale and saltine crackers. I did that for many years. Ginger can act as a smooth muscle relaxant and kind of help relieve, intestinal spasms for people. But most ginger ale, honestly, doesn't even have ginger in it. So really, if you're having stomach upset, having like fresh ginger tea or ginger flavored tea can be very helpful, but really try to avoid any sort of carbonation. Another key thing here is everyone's kind of on this smoothie kick or juicing kick. When you whip foods or put it in a blender, it may have nothing to do with what you're actually blending, but have everything to do with the mere fact that in a blender, it introduces a lot of air in there. So believe it or not, even though you don't see the bubbles and it's not carbonated, you're actually swallowing a lot of air just from that blending motion. Any sort of artificial sweeteners, particularly your sugar alcohols like sorbitol, which is in a lot of sugar-free candy, is a major gas former. Too much of a good thing can actually be a bad thing in many people. And so although fiber is very important for gut health and regular bowel movements, if you go from 0 to 60 grams of fiber, you're not going to be able to tolerate that. So as you start introducing fiber, fruits and vegetables, you have to do a slow reintroduction. And then again, you want to limit or avoid these high FODMAP foods. So this just kind of goes over everything that we already went through. This was an article that I co-wrote. So it goes to, again, sticking to low FODMAP foods. You want to try to cook down your vegetables well. Having a whole head of raw broccoli will definitely be worse for you as far as gas formation, as opposed to having maybe a cup of steamed broccoli. So if you really want a high FODMAP food, that is totally fine. It is not causing harm to your bowel. But if you eat a whole head of raw broccoli, anticipate the bloat. That's going to happen. So cooking it down very well and monitoring the portions can be very, very helpful. Okay, so there's a lot of charts online that you can go through. A lot of my patients come to me in clinic and they say, I've already been to another gastroenterologist. I was told I can't have any high FODMAP foods, that I need to be on a low FODMAP diet. And doctor, I just don't know what to eat. And believe it or not, my goal is not to overcomplicate the process. So I basically print out 2 charts for people. I print out the green chart, which are low FODMAP foods. and I print out the red chart, which are your high FODMAP foods. And what I tell people, because everyone is different, what I tell people is, I want you to choose more foods on the green chart and less foods from the red chart. And maybe put it on your refrigerator, or print it out for you, and you can take it wherever you go. And you can start to actually check off or cross off items that you do well with, or that you don't do so well with, because everyone is different. So for instance, if I'm looking at the green chart here and I want to make a stir fry, so I'm looking for vegetables to add, then, and let's say I suffer from a lot of bloating and belching, then if I'm making a stir fry, I will probably do much better if I did, let's say, bamboo shoots, green beans, and maybe some chopped celery and chopped carrots and bok choy. Those things will give me less bloating than if I went to my vegetable options here that are your high FODMAPs, and I had asparagus, beets, broccoli, Brussels sprouts, cabbage, and eggplant. I would have a lot of bloating if I put 6 high FODMAP foods together than if I chose more foods from the green. So again, everyone is different, but these charts can be very helpful for people to, again, prioritize more low FODMAP foods, and really try to limit those high FODMAP foods. So now we're going to talk about heartburn and dyspepsia. So heartburn is basically, common symptoms include coughing or bitter taste in the mouth, burning in the chest, or regurgitation where you eat something and the food just comes up undigested, and then burning in the upper abdomen. And these symptoms are often worse after eating or drinking. Functional dyspepsia is a feeling of fullness after eating associated with abdominal pain. So very, very common symptoms. These definitely give me job security. So what do I tell people who suffer from heartburn or burning in the belly? Again, I used to give out PPIs or proton pump inhibitors like candy. They are antacids, and there's a million antacids on the market. So it's a lot easier for me as a healthcare provider. If someone comes into clinic and says, "Doc, I'm suffering from a lot of heartburn," it takes me 2 seconds to say, "Okay, take this antacid. I'll see you back in 6 months and let's see how you do." That's one way to go about it. But at the end of the day, our body makes acid for a reason. We have cells in our stomach that create acid, and that helps us break down food, that helps us digest food, and that allows us to absorb critical nutrients. And so if I give someone high dose antacids and say, "Take this indefinitely and eat whatever in the world you want," that's not really doing the patient any service, because they can actually have issues with actually maldigestion and malabsorption if I'm shutting down all of their acid production. So again, it all goes back to, how can we modify what we're eating and modify our lifestyle in order to reduce the symptoms in the first place? So really trying to avoid medications unless I have a really clear indication why someone's going to need a long course of an antacid. So we want to, again, limit foods and beverages that stimulate excessive acid production, and also limit foods that relax the lower esophageal sphincter. So here is the mouth. We have our upper esophagus here, middle esophagus, and distal esophagus. At the bottom of our lower esophagus, where it connects to the stomach, we have this sphincter, and it acts kind of as like a valve or a door. When we eat the food bolus, we chew it, the digestion starts in our mouth, the food bolus gets pushed down using the smooth muscle in our esophagus. So propulsive forces are going to push just like this, the food bolus down into the stomach. When the food goes down, that sphincter opens or relaxes, allows the food to go into the stomach, and then that's where digestion occurs. Some foods and liquids and things like tobacco or caffeine actually relax that sphincter. So what happens is that whatever food you ate is now sitting in your stomach, it's being digested, but the sphincter is supposed to be closed to prevent reflux. But if that sphincter is now relaxed, whatever contents, whether it's acid, bile, or food, it is more likely to then reflux back up into the chest or into the esophagus because that sphincter is relaxed. So really trying to reduce excessive acid production and minimize foods and beverages that relax that sphincter are very helpful when it comes to reducing symptoms and complications that can come from acid reflux. And then we also want to limit foods and beverages that cause excessive gas production. The more gas you have in your stomach, things are more likely to reflux back up. So they all kind of go hand in hand. So what does this mean when I'm talking to a patient about which foods and beverages to try to limit? It would be things like excessive alcohol, chocolate, high-fat meals, and tobacco. These things are all associated with a reduction in the lower esophageal sphincter pressure. Things like red sauces and spices and citrus and mint and caffeine, all these things are often correlated with patient-reported reflux symptoms. I think part of the issue when it comes to nutrition counseling is we don't have a ton of data that looks at pH testing and what that sphincter pressure is after eating certain foods. And so a lot of it is really just kind of patient-reported symptoms as far as what tends to cause excessive heartburn and things like that. So in general, my goal is not to give people a super restrictive diet. You know, going back to these dietary recommendations, people are going to look at me and be like, Doc, what do you mean I can't have coffee? You're absolutely nuts. Like I'm not going to survive. And so my goal is to work with people to figure out what's going to happen or what's going to work for them and what is realistic. So if someone tells me that they drink a whole pot of coffee a day, but they get terrible rebound headaches if they don't have caffeine, then I'm not going to take away all their joy in their life. I'm not going to take away all their coffee. But what I will tell them is try to find a healthy balance. So maybe instead of drinking a whole pot of coffee, well, maybe we can say, okay, let's try to cut back to 1 or 2 cups of coffee per day. And maybe don't put the cow's milk and don't put the sugar in there. Maybe have some unsweetened oat milk. And so at least some of those changes will definitely help. It may not be perfect, but at least it's a step in the right direction. What I tell people all the time is I do not expect perfection. I'm not perfect. No one is perfect, but I do expect progress. And I think if people truly want to feel better, they just have to eat better. And so it's a challenge, but it's absolutely doable. So lifestyle modifications in order to help prevent excessive acid reflux would be eating smaller meals, eating slowly. Again, it's so important that how we eat plays just such a huge effect on GI symptoms. So trying to sit down for 20 to 30 minutes per meal, really trying to avoid eating within 4 hours of lying down. Even if you are not sleeping, the mere fact that you're lying down to watch TV, all that food and whatever liquid you had is sitting in your stomach, it's not yet emptied, is more likely to reflux back up into your esophagus because of gravity. So the more upright you can stay after eating, really the better. And then limiting behaviors that increase intra-abdominal pressure. So things like corsets or abdominal binders, tight waistbands or belts, all that is putting extrinsic force on your belly, on your abdominal cavity, and it's pushing it on all of your organs. And so whatever's sitting in your stomach or intestine is more likely to reflux back up. Okay, so now we're going to talk about food allergies, sensitivities, and intolerances. So we always need to kind of go back to what is normal, because if we don't know what normal is, there's no way we can really identify what exactly is abnormal. So there are normal physiologic responses that happen after doing certain things. And so eating large meals, we are, putting a ton of contents, food and liquid in our stomach. It is normal to feel distended. And if you pack your stomach in with 3,000 calories worth, it's actually normal to regurgitate because you have so much in your belly that there's only so much your stomach can accommodate. So people will often regurgitate. And so you really have to listen to your body. I know it's hard, but when you don't feel well, you have to kind of take a step back and say, okay, I just regurgitated, or I feel super bloated. So what just happened? Well, I shoveled food in my mouth. I sat down for 5 minutes to eat lunch. I ate 2,000 calories because I don't know when my next meal is going to be. And my body's trying to tell me, Michelle, slow down. And so we really have to listen to that. It's really our body trying to send our brain signals to try to change our behavior. Eating very fatty foods slows down gastric emptying. So fat is the macronutrient that has the biggest role on how fast your stomach empties. So if you eat, French fries and a high-fat burger and onion rings on the side, your stomach is going to take a while to empty that food. And so it's all going to just sit in your stomach for a couple of hours. You may feel nauseated or kind of sick to your stomach. It may have nothing to do with your body. It may have everything to do with the food. So, one of my goals, what I kind of tell people is, and what's been interesting as I've been in practice for a few years now, is that oftentimes, patients come to me and they say, "Doc, I don't feel well after eating. What is wrong with my body?" And sometimes there is something wrong with the body, and that obviously warrants investigation. But more often than not, it's not what's wrong with our body. We should be asking what's wrong with our food. And I think that's so critically important. Again, these high FODMAP foods that cause excessive air production, it doesn't mean there's anything wrong with your intestine. These are normal processes that happen after consuming these high FODMAP foods. Things like sugar alcohols or too much fiber that are non-absorbed or poorly digested by the human body can definitely cause bloating, diarrhea, and flatulence. And again, passing flatus is actually normal. So these are all normal responses to common foods that we eat. So there are a ton of different food allergies and intolerances and autoimmune conditions. And this is where it can be very, very challenging. So patients aren't going to come to me and say, "I have a food allergy per se." They're going to say, "I eat something and I don't feel well." And so it's my job as a gastroenterologist to try to figure out, is this an allergy? Is it an autoimmune problem? Is it an intolerance? Or is it a sensitivity? And although we often use these terms interchangeably, they are actually all very different problems. And so trying to figure out which one it is a huge challenge, but it's very important to kind of piece things together because it has huge implications on how I counsel my patients. So when we talk about adverse food reactions, the ones that we really want to worry about are going to be your food allergies. So food allergies, typical food allergies are going to be IgE mediated. And what does that mean? So it means if I eat peanuts or I eat shellfish and I develop anaphylaxis where I get my blood pressure drops, I get, I feel really sick, I start having nausea and vomiting. I may get swelling of my airway or swelling of my throat or lip or mouth swelling. I may get hives. Those are your typical IgE mediated food allergies. So I don't need an allergy test to tell me that. If someone tells me they get hives or throat swelling after eating peanuts, that is a true peanut allergy, and they need to have an EpiPen, and they need to really be strict about food avoidance, so avoiding peanuts if that's their reaction. So that is critical because you need to have an EpiPen and you need to be very, very strict about that allergen avoidance. But the reason why food allergy testing is actually very difficult to interpret is because people can also have non-IgE mediated food allergies. And that can give people, let's say, migraines or non-specific GI symptoms like bloating or diarrhea, or just feeling a little bit nauseated. And so the allergy testing is, whether it's the skin or the blood, is testing for IgG protein. But if this is a non-IgE mediated allergy, it's going to come back negative. So really what I tell people is, okay, if you eat peanuts and you don't feel well, even if you don't have anaphylaxis or hives, I'm not going to recommend that you eat peanuts. I would avoid the food trigger that's causing you to not feel well. But that's why food allergy testing can be very difficult to interpret. Other things that we want to make sure that we rule out would be the autoimmune condition called celiac. Because if you have an autoimmune condition to gluten and you continue eating gluten, whether or not you have GI symptoms or not, that actually can cause damage to your small intestine and lead to issues with malabsorption and small bowel cancers and low bone density, fertility issues, etc. So anyone with any of these common GI symptoms, make sure you talk to your provider about making sure you are tested for celiac disease before you go gluten-free. Once you take out all the gluten from your diet, it makes testing for celiac disease actually much more challenging. So those are your food allergies, which really requires food avoidance. That's one of your autoimmune conditions, which is celiac. but there's also other autoimmune conditions like eosinophilic gastroenteritis or allergic contact dermatitis. Those are immune problems. And then you have non-immune issues. So things like lactose intolerance. When we talk about intolerances, that really has most to do with digestion. So breaking down, particularly carbohydrate molecules. Lactose intolerance is not actually an allergy, and it's not actually a disease. Lactose intolerance is actually normal. It's actually abnormal or a genetic mutation for us as humans to still have the lactase enzyme in our small intestine as we age. So depending on where you grew up and what sort of foods you ate and things like that, and if you grew up on a farm and drinking tons of cow's milk, you may have that enzyme later in life. But if you didn't really drink much cow's milk, you will often lose that enzyme as you get older. And so for the most part, I tell people cut out the cow's milk and cut out the soft cheeses, and people do just fine. So really the long story short here is that there are a ton of adverse food reactions. Everyone is different. Some can be autoimmune conditions, some can be allergies, some can be, you just lost some enzymes in your small intestine that help you break down some of these carbohydrates. But trying to, piece things together and figure out what your particular issue can be very challenging. And that's why, a lot of people come to me with these adverse food reactions, so I can try to kind of parse through what the issue may be. So the FDA has basically made this guideline that all foods have to disclose whether or not they contain one of the 8 most common food allergens. So these are the most common ones: milk, eggs, fish, etc. And so this can help consumers who have food allergies avoid products that contain the major food allergens and derivatives. So food allergies in a nutshell, although food allergies are more commonly seen in kids, they can develop at any age. So that's very important to realize. They are common reasons for ER visits. And so really trying to figure out, are you having a typical allergic reaction? And if you are, making sure you talk to your provider about having an EpiPen if you have a severe one like anaphylaxis or lip or mouth swelling. The other thing to realize here is that these regulatory guidelines when it comes to disclosing common food allergens on the label does not pertain to all foods. So some of the products by the USDA like meat, poultry, and eggs do not actually disclose it. Alcohol and tobacco products don't have to disclose it because the FDA does not regulate these things. Also things like cosmetics and shampoos and other health and beauty aids like chapstick don't have to disclose it. Although hopefully you're not eating your chapstick, you still absorb things on your skin and through your lips, through your mucosal membranes. And so even if you're not eating the chapstick, sometimes if the chapstick contains, let's say, gluten, that may actually cause an issue for you. So all these things are actually very important. So really, when you have a food allergy, the mainstay of treatment is avoiding that food. Skip over that. So I remember I used to see these gotten milk ads all the time. Now, I'm not sure where they went, but it really taught people that the only way to have strong bones and be a superhero or be a rock star or be a celebrity is that if we drank 1 or 2 glasses of milk per day, we could do whatever we wanted. But really, when it comes to milk in general or dairy in general is quite pro-inflammatory. There's a lot of growth factors in it. And then milk in particular has a lot of sugar. So whether it is skim milk, 2%, or whole milk, it's got about 12 grams of sugar per serving. And sugar in general can lead to acid reflux and bloating. And then put on top of that, if you're lactose intolerant, you may be running to the bathroom with diarrhea or having major issues with bloating. So a lot of these health claims are not actually true. You can get plenty of calcium from other things other than milk. So not all dairy products contain lactose. I have a lot of people that say, well, doc, but I can have cheddar cheese or American cheese and I do just fine. So not all dairy has lactose. Lactose is typically in cow's milk in higher amounts in soft cheeses, things like cottage cheese, feta, mozzarella, your soft cheeses. but your hard cheeses typically don't have lactose. Greek yogurt is a great source of calcium and probiotics and protein. And although there is a very little amount of lactose in there, the probiotics in it actually break it all down. So even if you are lactose intolerant, most people can actually tolerate plain Greek yogurt. So I'm going to skip over that. So common symptoms of lactose intolerance include diarrhea and gas. Some people get abdominal pain, although it's not the predominant symptom. But a lot of these are just very non-specific symptoms. So someone may come to me and say, Doc, I'm bloated and I have diarrhea. They're not going to come to me saying, Doc, I have lactose intolerance. So again, my job as a provider is to really understand what are people eating and drinking on a regular basis, try to find common patterns and figure out what the culprit may be. And many times it can be very challenging. So some alarm symptoms that you should be aware about, so things that you definitely want to seek your help from your healthcare provider would be if you have severe or prolonged abdominal pain or it's been getting worse, any sort of GI bleeding. So if you're throwing up blood or having black, tarry, sticky stools or bright red blood per rectum, these are all reasons why you would need a more thorough evaluation. High fevers, persistent diarrhea, any symptoms that are getting worse with time, like worsening heartburn or vomiting, or any unintentional weight loss. So all of these things would warrant further evaluation, first typically by your primary care doctor, but often for GI bleeding or more persistent or severe symptoms by usually a gastroenterologist. Okay, so some key points here before the Q&A would be, healthy eating behaviors vary from person to person. As we get older, as our body changes, we take different medications or have, a viral gastroenteritis that can affect our microbiome. Our nutrition has to be just as dynamic as our body. And so that's very important. What you are able to eat at the age of 10, 20, 30, 40, and 50 is going to vary. And that changes with so many internal and external factors. So counseling often needs to be personalized for each individual person who suffers from chronic common GI disorders, and really trying to empower you all to track what you're eating. It doesn't necessarily mean you need to download a mobile application and track every single thing you're putting in your mouth, but it can be very helpful for your provider if you're able to keep a food diary at least a couple of days out of the week, whether it's electronic or on paper. Then also track, if you're having diarrhea or bloating or heartburn, then we can really look through that and see, okay, well, it looks like, Mrs. Smith, that every time you drink ginger ale, you feel bloated. Let's cut out the ginger ale. But a lot of things, when people try to give me an accurate dietary recall and try to remember everything they've eaten within the past 72 hours, it's near to impossible. So the more information that you can keep in real time, it can really help your provider try to pick up these patterns. Here's a grocery list that I have on my website that can kind of help people navigate the grocery store. So it is listed as like fruits and low carbohydrate vegetables, higher carbohydrate vegetables, plant-based protein and animal-based protein items. The items that are highlighted in blue can cause more bloating, so they're your high FODMAP foods, and the foods in red can cause heartburn in some people. So this list, you can actually from the website download a PDF, and you can take to the grocery store with you or have it on your phone, and it can help you kind of navigate which items to get to help reduce common GI symptoms like the belching, the bloating, the diarrhea, and the heartburn. Okay, so I know I went through that very fast, a lot of information, but I wanted to give 10 minutes time here to have a Q&A, so we can go over questions here for you all.
And remind everyone. You got some praise, Dr. Pearlman.
Taryn, you kind of cut out. I didn't hear you.
Hi, can everyone hear me now?
Yes.
Okay. I didn't get any. But thank you.
Okay, so you all can hear me. So I'll go ahead and answer these questions. So cooking vegetables, let's see. When you suggested cooking vegetables to cut down on gas, does that also cut down the fiber content? So no, you still get all the fiber. It really just kind of, I guess, pre-digests it and makes it more tolerable. Everyone is different, but a lot of times if, let's say, people really like cauliflower or broccoli, and me personally, what I'll do is I'll actually steam the broccoli or I'll steam the cauliflower, and then I will actually blend it in my NutriBullet, and I'll add a little bit of low sodium bone broth or chicken broth to it and actually create like my own little puree. So it's kind of like baby food. And it kind of, if you use your imagination, can kind of taste a little bit like mashed potatoes. But I think in general, people tolerate higher fiber, higher FODMAP foods better when they cook it down. Any other questions? Yeah, so the histamine question. So I got a question about how do you know if you have a histamine intolerance? Can it cause lymph swelling if too much histamine is consumed? Yeah, I mean, it's a challenge. Being on a low histamine diet can definitely be a challenge. But, it really just depends on, working with your provider, keeping a food diary, and really trying to figure out if you can find common patterns. But it's definitely, it's hard to kind of piece through, particularly the histamine type the food issues. Another question, is it better to steam or roast or saute vegetables relating to gas production? So a lot of my patients also struggle with their weight. And so it's not just, again, what you're eating, but also the mode of food preparation is very important when it comes to reducing calories. And so when you saute vegetables or when you roast vegetables, you're often adding a lot of oil to it. And that oil doesn't just disappear, you're still consuming those calories. And oil is basically all fat, so it's very calorie dense. So if you're trying to kind of watch your calories, then really steaming would be your best option because you're not adding any additional calories. And roasting and sauteing, because you're adding a bunch of oil typically, can cause, add additional calories to it. Also, some people have intolerances to certain oils, or when you're adding oil to food, it's going to slow down the stomach emptying. So if someone already has issues with feeling really full after eating, then that additional oil may actually worsen some of the symptoms. One thing I forgot to mention earlier was we often forget the importance of seasonings when it comes to GI symptoms. That often that's a telltale sign when someone tells me that they have GI symptoms after everything they eat. I ask them, okay, well, what do you add to most of your food? And almost always it's people are adding garlic and onion or adobo seasoning to everything. And garlic and onion are high FODMAP foods. So I don't care if it's fresh garlic or onion or dry seasoning, stuff like that. That often causes people to have issues with gas and bloating. And a lot of people who suffer from high blood pressure, they start using like the Mrs. Dash or the other no salt seasonings. But most of these seasonings are full of garlic and onion. So based on that grocery list that I sent out, it tells you kind of how to use herbs and other things that you can add to your food to still give it flavor, but really try to limit the garlic and onion. So another question, do I ever recommend miso as a flavoring and to help improve the gut microbiome? So in general, I really try to figure out what are people's, food preferences and things like that. in general, to improve the diversity of the microbiome, it's really eating dietary fiber. So the dietary fiber that we consume basically feeds the gut bacteria and helps promote a good biodiversity. So it's not necessarily the miso that's going to, promote good biodiversity. It's really dietary fiber in general. And that's really the probiotic. So probiotic is that, or probiotic are, good bacteria. Prebiotic is the fiber that we feed the bacteria. Now, again, you can't go from 0 to 60. So you can't go from not eating any fruits and vegetables and nuts to then having a quinoa bowl with chia seeds and flax seeds. You got to take it slow. Too much of a good thing can give people a lot of GI symptoms. So you really want to do a slow reintroduction. So it may be that, I'm eating my normal stuff and maybe I want to increase fiber. So it may just start with having, a serving of pureed pumpkin or some butternut squash and keeping that consistent for 3 days. And then if I feel fine, maybe I'll add in, some steamed cauliflower. So you do a slow introduction of one food at a time over a couple day period to kind of see how you do. One of the challenges with adverse food reactions are if it's a non-IgE allergy or a autoimmune condition like gluten or celiac disease or a food sensitivity, some of these reactions are not immediate. So if I eat peanuts and I have a peanut allergy and I get hives, that's an immediate reaction. That's very cut and dry. But if I have, let's say just a food sensitivity to broccoli where it gives me a lot of gas, I may not feel the gas until 8 hours later, or maybe the next day. It may have nothing to do with what I just ate, but what I ate the day prior. And that's where food tracking can be very, very helpful. Yes, so another question, is it a myth that drinking too much water with your meals inhibits digestion? Is there a better time of the day to drink water, and how much is appropriate? So fluid balance, it gets a little bit complicated because it depends on if someone has kidney issues or liver issues or heart issues. So you definitely don't want to overdose on water because that can cause a whole host of issues on its own. But in general, if you're already thirsty, you're probably already dehydrated. Really, in order to maximize digestion, you want to chew your food. Obviously, you want to swallow it. You want to let it into your stomach, get it broken down by the acids and other digestive enzymes, allow the bile and pancreatic enzymes to help act as a detergent to break it down further. And you want to just have sips of water with your meal. The majority of your liquids should actually be consumed in between meals. Often people, if you're gulping down fluid with your meals, you will also, suck in excessive air. That may lead to issues with bloating or regurgitation, make you feel super full. And so really having your liquids in between meals is the best option.
Hi, hopefully you can hear me again.
Okay, perfect. Well, thank you all so much for joining the session, and I look forward to the next one.